for inviting me here. So after this utterly fantastic lecture by amazing women this morning, I think there is no question that there are so many fascinating women in this whole conference, and especially this morning, that anyone to doubt that would be a fool. So I'm here with my adrenaline and cortisol high. So let's see. So I'm from Austria. So I'm really the odd person who went all the way from Austria to go here. So it's really a 4-hour flight. But I need to change once. So because it's common to confuse this at SMAC and in the world in general, I put up this sign here, and of course that's how our roads look like in Austria. And to make it clear that really happens, not a while, not such a long time ago. Again, so I think Australia really has so many resources, they should try to allocate them better than building fences at our neighboring country. But okay, so actually this is part 2. For those of you who haven't seen the talk by Christine Bowles last year, Sex in Critical Care. So I'm building on that, and it's a very interesting talk in itself. So actually, critical care is no place for women. Of course it is, because already now in, I guess, any ICU in the world, the majority of people working there are women. And it's a lot of the nurses, a lot of the physiotherapists, etc. If you just consider a lot of the healthcare workers, the vast majority are women. But of course, critical care is one of the specialties with very few women, especially as faculty on this side of the auditorium, very few women who are researchers, very few women who are in leading positions in ICUs. So, of course, ICU is a technical specialty, so it's maybe big toys for the big boys, and a lot of the big boys that are out there are very excited about their new ventilator and their new pump and their new whatever. But just if you consider also thinking about the last lectures, a lot can come from very little resources, and it's not necessarily the advances in technical equipment that will really bring us and our patients to a better future, but probably it is also the soft factors like love and like caring and like teamwork, etc. And so I think that's an important aspect of that all, despite all the medical and technical equipment. And I can assure you, as a mother of 2 girls, if you catch them early, they can be they can be really excited about technical equipment. So now that before I heard what can be done with a drill and a Swiss knife, probably I should give my 2-year-old a Swiss knife and see if she also finds it fascinating as this electric drill. So, some of the few comments that I and colleagues have recently heard, and I didn't really care putting the hashtag in because you can all look it up. So that's what recently a patient on the general ward said to me. Oh, wow, you're a professor. I mean, that's amazing. And of course, she was well-meaning, but it's that current or also very frequent misinterpretation of what women are doing. So often we are considered to be not physicians and not doctors, not professors. And I think also SMAC, we all don't look like professors, do we? Even if we are. And it just shows you that regardless your appearance, your thoughts and your accomplishments and your mind is much more important than what you look like. So there is a hashtag, I look like a professor, I look like an intensivist, I look like a doctor. And it's really interesting things you can see there. So another colleague of mine, she went out to a supermarket to just grab in between a bottle of water or whatever, and an elderly man approached her and said, can I ask you something? So she was in full Austrian emergency medicine doc equipment, you know, doctor, emergency doctor, all over her. And he was like, are you really a doctor? And she was like, I even am an emergency doctor. And he was like, oh, was it an indiscreet question for me to ask? But it cannot be. I mean, you cannot be a doctor at 20, can you? So it's really now I'm also getting to the age where I appreciate these kinds of comments, but still, it shows you that families, patients often are insecure and they feel a little stressed out when there is no doctor that's coming. And I've also worked in the emergency department at our hospital. You know, we have green pajamas, as I call them, and everybody has green pajamas. Like here, everybody has smack T-shirts, and it's indistinguishable by the look, who is who. And even though hashtag hello, my name is, even though we do that, often it happens that after hours with a patient and with a family, they ask, so, and when are we going to see the doctor? Like, yeah, that's me, hi. Been around for a while. So, and another thing about women in science, and that's really a famous quote now, especially in social media. So Tim Hunt, Nobel Prize winner, it's really, women beat him with humor in the end. He said, the problem with women in research and in labs is you fall in love with them, they fall in love with you, and when you criticize them, they cry. So I guess most of you are familiar with the hashtag distractingly sexy. So that's one of those. So if you're in a research lab, feel free to take that. So Steve Diggle said, okay, use it, because it's a very important sign. So just to keep the housekeeping rules clear in mixed research labs. And of course, there's a lot of literature, a lot of publications that are not specific to critical care at all, but that are generalizable to our setting as well, and that show how often women, I mean, no matter how you call it, but how women are lost on the way. Either you call it a glass ceiling or a sticky floor or whatever, and they're really very interesting, really interesting literature on why that is and on experiences, etc. And one of those really very mind-changing studies for me is this one, Nepotism and Sexism in Peer Review. Of course, that was a long time ago for nowadays, so 1997. That is a study from Sweden. So I guess everywhere else in the world than Sweden, it's probably not such a problem. But what they did, the Medical Research Council of Sweden, who is the publicly funding agency in Sweden, they give out research money, and the two women researchers asked them to give out their review charts on how they judged who would get the research money. And they said, no, we don't give you that. And in Sweden, apparently everything that is not top secret must be given out to the public on request. So they sued the MRC, and they won, and they got all the data, the original peer reviewing data, and they found that if you were a woman, you had to have 2.5 times the productivity of a man to get the same subjective score in the reviewing charts. And it's not only sexism, so if you were in the research lab of one of the jury members, even though this person wasn't allowed to vote, herself or himself, still it gave you approximately the same credit. So they made a really nice logistical regression on the factors that favored you getting research money. And of course, it's in Sweden, 1997. So likely nowadays everything is much better. So, but there are other papers from sociology and other sciences. If you make up a paper and you send it in as John, it gets a much better review than a paper written by Joanne. And it's true for female reviewers and for male reviewers. It just may get you to think about peer review in general, and also as a one-blinded, two-blinded, no peer review at all. It has been discussed at this conference. So it's a challenge, and there is a gender-specific aspect to it. So I was a little reluctant at first to show this, and I had this in the slides before, and I'm very grateful to Simon Finford to have pointed this out before. So this is the paper of the decade, no? So the Sepsis 3 definition is that not every year that we get a new definition for one of our major problems in ICU. And of course, it's not new anymore. So you know, there are 19 authors, 0 of them is woman. So despite Mervyn Singer saying to be a sex god, I cannot judge it, he doesn't know a single woman who knows anything about sepsis, it appears. So, what about the facts? Actually, it is not so easy to get really numbers, but I'm going to show you what I found. So, women as ICU trainees, at least in the UK, it's 35%. So, it's not that few women, actually. Women as ICU consultants, on the other hand, it's 21%. Women in ICU editorial boards, 7%. So, that is actually my own data. So we did a study where we really counted men and women in editorial boards of 12 medical specialties, including pediatrics, for example, and gynecology, trauma surgery, and critical care had, in 2011, the lowest percentage of female editors of all the specialties we looked at, lower than trauma surgery. And I really have a hard time believing what Jeff Drazen said the other day, that he asked women to be editors at the New England Journal of Medicine, and they turned him down? I don't know. Would you turn him down if Jeff Drazen came to you and said, look, do you want to be my new female editor? I don't think so. So raise your hand who wants to be editor at the New England Journal of Medicine. Yeah, some of you. Thank you. So Jeff Drazen, if you watch this, please refer to the persons who just volunteered. Okay, and women in ESICM faculty, for example. So classical critical care conferences, not like this one where we're all good friends. Sometimes, yeah, it's a lot of many big boys, and all of them are very friendly, and all of them are very nice people. But in the end, when it comes down to ESICM faculty, it's 15%. It's not a lot, is it? And there is another really funny Australian thing. So Dr. James Fox is an Australian speaker who obviously now refuses to take part in all male panels. And he sends the organizers that to tick why they couldn't find any women. And I can assure you it's much more difficult with women because it's really hard to get the microphones on them, so you have to really look about their hair and all. So it's another thing that I would put here maybe in the free. But it's like, that's the answers that he's getting. You know the 2 women that I phoned, they didn't want to, and all the women were busy, and you tell me who. So again, SMAC is different. So SMAC has really very, very positively shown us in the last day that if you care and if you look hard enough, it's possible. So here I asked the organizing committee, 50% approximately of the attendees are women. And approximately 40% of the speakers are women. And also, I don't know if it's world premiere, but I think an all-female panel on a major stage in critical care, just as before, with such an overwhelmingly excellent content, is possible in 2016. And it should be inspiring. Yeah, thank you. So thank you, SMAC. Thank you, all the organizers, and Ollie and Roger and Harry and Chris, who thought about it pretty hard, and also Christine, I guess. So it's possible, and we can do it again. So it's just not all of the speakers had their pictures on the website, as you see. For example, Dara isn't on the website, as I know, but so it's even more excellent female speakers we have. And now, my conflicts of interest. I show them to you now, because now you know me, now we know each other, it's a friendly atmosphere, and because if I had shown them to you before, you would have thought I'm a bit incompetent, because actually I'm not a full-time intensivist. So you think, okay, you know, she's a mom and she has 2 young kids, so she's a part-time intensivist. Which is true, but actually, I'm a hobby intensivist, sorry. Maybe never get invited to any critical care conference at all. I'm an endocrinologist. So my medical number 1 hobby, as I say, is critical care, and I love critical care, but endocrinology is also an awesome specialty. And what you learn in endocrinology, more and more these days, you can change gender. So you can be a woman and you can change, or the other way around. It's possible, also that. So I don't know what we do with the statistics with that. And it's even more complicated. Recently I had a patient who was a man, now he wants to be a woman, and guess what? His karyotype is XX. Really fascinating stuff. Okay, so do babies matter? Who is a parent? Okay, a lot of people. Who is no parent? Okay, it's approximately half-half. Okay, so the divide, really, I found in professional life is not really so much men and women, it's more parents and non-parents. There's really a Grand Canyon between them. Because do babies matter? Of course they matter. It's like having a SMAC conference every day of your life. And every night. So you partied hard last night, still you have to be here at 6 a.m. But it's fun, it's great fun, it's awesome. So, all the parents of you know what I'm talking about, and all the others are like, what is she talking about? So if you ever become a parent, it's a very fascinating time, the time from being a self-confident, self-controlled individual to being under total control of somebody else every single minute of the day. It's fascinating. So, and there's another fascinating thing, it's called motherhood penalty. So that's also why I tell you now I'm a mom. She told you before, she spoiled it. No, it's fine. And what is even more fascinating, there is a fatherhood bonus. So if you give people a CV of a woman who has children, no children, a man who has children, no children, same CV otherwise, the women would get less entry salary, they would be held to higher standards for punctuality and other things, and they would be less considered for promotion. So clearly, just being a mother is perceived as a problem. And very interestingly, for men, it's the other way around. Because being a father, obviously you need to care for your family, and it's really a great thing that you manage to have a family, so it's a competence. So that's what it's broken down to. Less competent, less committed, held to higher standards, presented with fewer opportunities. So that is why, if you're a mother, especially, you must make it very clear that despite, or because of having kids, you're still interested in working and not planning on giving it up, and you want to do things. So that's my personal career in just a slide. That's my major research so far, vitamin D in intensive care. So pediatricians know about vitamin D. But for everybody else, it's what I'm working on still, and it's a very interesting, very rewarding topic. And when so it's 2011, I had my older daughter, 2013, my younger daughter, and she needed to come for the hot topic session in Barcelona because she wouldn't get herself weaned off. So she was still nursing at that time. And really, there are no pictures from how this paper was reviewed and reviewed again, and how I worked on it, because it was the major part of that was done at 3 a.m. one-handedly nursing. And I thought, it was at another journal before, and I thought, I don't know if there are any statistics for that, but probably not many people have been there. But it's possible, and I encourage you to just not stay behind your possibilities because you think it's hard. It's hard, it's exhausting, but it's possible. So, and there is proof for that. So scientists want more children. If scientists have fewer children than they wanted to, they are more likely to entirely leave their scientific careers. And of course, so the non-parents in you, I don't want to scare you. It's really the most fascinating thing you can do in your life, to see a baby who is really overwhelmed with the world, become like this in 4.5 years and become like this in 2 3/4 years. So it's really very fascinating, and it will be fascinating in the future as well. So that's already my links, what I would recommend you. So especially this one I find very important. It's important for all of us, but it's even more important for women, because with all this stuff that we have to somehow organize, often we take no or very little time for ourselves, and that's really something I recommend to you. Of course, these other resources, also Women Matter from McKinsey, it's also very interesting, of course, with a focus on the corporate world. Lean In, Sheryl Sandberg, Distractingly Sexy if you want something to laugh after a hard day. And just with the memorial of John Hines, so ask you, also the young among you, the young men, young women, what would you do? What would John do? What would Sheryl do in the women debate? What would you do if you were not afraid? And there's no reason to not do it, just because it might not work out. You should still try to do it. And for me, it's like continuing the journey of vitamin D in intensive care. It's hard, and it's going to be a lot of work, but it's going to be fun. And for you, it's really up to you to find out what is it for you that you would do if you were not afraid and not worried about the consequences. So, I conclude, critical care is, of course, a great place for women. Thank you.
So I want to say thank you, obviously, for the shout out, especially I owe like $10 now, I think, to get in the nice middle of the slide in anticipation of our talk later. I want to thank you for a great talk. I think that, discussing a lot of these issues is hard sometimes. Revealing the things that you do and your kids and putting them up there isn't always easy, but I think it's important for all of us to be able to have this conversation and bring it to the next level. So with that, Salim.
Yeah, so there's a lot of common themes. It wasn't so much about critical care and ICU, but one of the big common themes is, why do you think there's a lack of female speakers at conferences, and is there an easy way to fix that problem?
You don't have to ask me, you have to ask the SMAC conference organizers how they did it. I mean, I guess it also depends. I guess no woman who would be invited by SMAC or any other similar conference, there's none. But who would be invited to a major conference? I don't think many women would say no. I mean, it's like Risa the other day said, I mean, if you invite people, if you encourage them, you can look at the female conference bingo, but you can overcome that pretty easily. It's not that hard. It's not really such a problem.
I think that's a good start to a great conversation. Thank you so much.
Thank you.